All right, chapter 25. This chapter is going to cover special considerations for the geriatric patient. All right, objectives for chapter 25. Review the major stages of lifespan development of the adult patient. Define the following terms: Alzheimer's disease, dementia, elder abuse, elder neglect, elderly, geriatric, self-neglect. Describe the general characteristics commonly associated with geriatric patients. Describe some of the most common age-related physical changes found in geriatric patients. Describe the common medical problems of geriatric patients. Explain the unique challenges that can arise when assessing and caring for the geriatric patient. Describe the changes in the approach to the care when caring for geriatric patients. Describe common signs and symptoms of abuse and neglect. Explain the role of the emergency medical responder in cases of suspected abuse and or neglect. Demonstrate the ability to properly assess and care for the geriatric patient. Demonstrate various techniques that can be employed to maximize successful assessment of the geriatric patient. Value the role of the emergency medical responder with respect to patient advocacy. All right, understanding geriatric patients. All right, understanding geriatric patients. Geriatric is of or relating to an elderly person. Elderly is a term used to describe a person that is 65 or older. Appropriate care of elderly patients involves understanding the physical, emotional, and financial difficulties commonly experienced by this group. That's figure 25.1. Just shows that the vast majority of the elderly lead healthy, active lifestyles. Just because you're a little bit older doesn't mean that you just sit at home and watch TV all day, which also means they're also prone to, some of the same traumatic type injuries that the younger population is. All right, what type of unique life experiences may impact the way an elderly person interacts with you? The biggest thing is going to be that they've been around a lot longer than we have, and they may have had situations where their health has failed them before, so they may know what to expect, and they also may be more anxious about the same situation. All right, what are some physical, emotional, and financial challenges facing the elderly? Physical is just going to deal with aging, failing body systems. Emotional, they may have lost a loved one. Their children may not be very involved in their life, or they may not have children at all. As far as financial situations, a lot of elderly are on fixed incomes, so they don't have the flexibility to, you know, cover a unexpected cost such as medical care. All right, treat an elderly patient the way you would want your own parent or elderly loved one to be treated. This just goes without saying, guys. It's somebody's family member, and you need to treat everybody you come in contact with just like you would like someone to treat your family member. All right, characteristics of geriatric patients. Elderly people commonly have multiple medical conditions, illnesses, or diseases at one time. This is referred to as comorbidities. This creates a unique challenge for the emergency responder who is assessing a geriatric patient. You may have multiple, medications, and the patient may present with symptoms of two different disease processes at once, and you've got to be able to filter through all that, and it can be very challenging, especially for an emergency medical responder. All right, so your job is to perform a thorough assessment and care for the primary complaint. We talked about this in class the other night. When you're doing your medical assessment, you've got to focus in on your life-threatening issues that are going on. Don't get lost in all the different things. Focus in on what is immediately life-threatening and treat that. Our elderly patients take numerous prescriptions and over-the-counter medications daily. The average person over 65 takes about 4 to 5 medications per day. Uh, you also have issues with them taking the incorrect medication or accidentally overdosing or underdosing themselves. All right, this is just another um, image. This is very typical. It's almost uncanny how many times I've seen this in an elderly individual's house. But one thing you also have to keep in mind is they can overdose or underdose themselves and the reasons for that. Um, Somebody overdosing may have just taken two of the same pill when they didn't mean to. It's typically unintentional. However, it could be an intentional overdose trying to harm themselves. Underdosing, a lot of times they'll try to stretch their medication for longer than it's prescribed to them. It may be because of financial situations or the inability to get to the drugstore to get their medications. So they may be trying to just stretch out that medicine a little bit longer, which causes them to underdose themselves and not be able to get the desired effect from the medication. Many elderly people use a pill organizer to help them remember when to take their medications. It's very effective. The challenge with a pill organizer, though, is if you ask for their meds and they hand you this, you're probably not going to know what these pills are, and they're probably not going to be able to take you. It's just a challenge, and it generally works out better if they just are taking them directly out of the bottle so we can look at them and be able to, tell what they're actually taking. All right, elderly persons live increasingly sedentary lives. They may deal with isolation, poor nutrition, depression, difficulty using the bathroom, loss of independence. They have a higher likelihood for falls and other injuries. All right, why might the elderly? Sorry, guys, my dog is gonna protect everybody, I guess. All right, why might the elderly have a higher likelihood of falls? They've lost the ability to be mobile. A lot of times they may have injuries that make them less mobile. They may not have the appropriate care at their home to take care of them, and they just predispose themselves for falls. One thing to think about: a fall, just a ground level fall from a standing position, is more serious for an elderly person than it is for a young person. One of the reasons is shrinking of the brain and the associated tissues inside the cranial vault, which means that there's more space for the brain to be able to bounce around inside the head and cause damage if you do sustain trauma to your head. Another thing is a lot of elderly individuals are on blood thinners, and that can just predispose you to a lot of internal bleeding type things, particularly with head injuries and bleeding inside the cranial vault. This is just an image showing somebody delivering food through a Meals on Wheels program. It can be very important to some elderly people. All right, many geriatric patients have some age-related sensory changes. They can have a lower sensitivity to pain or touch. A lot of times you'll see issues with them injuring themselves and not realizing it. Burns when they're cooking are very common, and they can be pretty severe before they can realize that they're actually being burned. They can have an altered sense of smell or taste. They can experience hearing loss, impaired vision, or blindness. This is just a table describing age-related difficulties with communication. Poor vision is very common. One way to combat this is to position yourself directly in front of the patient so you can be seen. Put your hand on the arm of a blind patient so he or she knows where you're at. Locate the patient's glasses if necessary. This can be extremely helpful and very simple. A lot of elderly individuals have decreased hearing. Just make sure you speak clearly. Don't yell at them, but just make sure you're enunciating your words and speaking clearly. Check to see if they have any hearing aids nearby and write notes if you must. Alright, so try letting in the patient wear a stethoscope and speak into the head of the stethoscope like a microphone. I've never done that, but I guess it could work. Alright, inability to speak clearly. Ask the patient to put dentures in or adjust them if possible. Sometimes they're just not going to be able to speak clearly no matter what you do. Right, this is just an image of a rescuer trying to make the patient feel more comfortable. He's positioning them at their level, making eye contact and speaking slowly and clearly. Be sure not to yell. It doesn't make them be able to hear you any better. 15 to 60% of all elderly people suffer from some type of incontinence. Diseases such as diabetes, illnesses that can cause diarrhea, and certain medications predispose them to this type of issue. Confused or altered geriatric patients can become belligerent, argumentative, or physically abusive. Keep your own safety and the safety of others in mind. Just a point to make on this, just because somebody is elderly does not mean they cannot be dangerous to you or your partner or others. I've been in situations several times with elderly individuals that you would not think would pose a threat, and they can be surprisingly strong, and they can be very dangerous. So don't take any offensive language or attitude personally. Don't allow yourself to be in a position where the patient can easily assault you. Elderly people are more prone to assault than most populations, in my opinion. You respond to a nursing home where you're met by a LPN that reports a patient has fallen from a chair. You find a 92-year-old male seated on the floor complaining of back pain. You begin to question him and he yells, "Don't touch me or I'll suck you in the nose." How do you proceed? Like I said before, you need to take him seriously. Take the threat seriously. He may very well punch you in the nose if you try to touch him. The best way to handle that situation would be to explain that you're there to help him, that you don't want to force him to do anything he doesn't want to do, but you would like to check him out. More times than none, if you let them know that they're in control of the situation, they'll be a lot more likely to work with you. All right, age-related physical changes. Respiratory system, you're going to have reduced strength and endurance of respiratory muscles, decreased chest wall flexibility, loss of lung compliance or lung elasticity. Collapse of the smaller airway structures is common. All right, so what major lifestyle choice can help keep the respiratory system healthy? Uh, Never start smoking or quit smoking. That's the single most important lifestyle choice that you can make. All right, cardiovascular system. You have enlargement of the left ventricle. This is also known as left ventricular hypertrophy. You may have a stiffening and elongation of the aorta, degeneration of the heart's electrical system, and loss of elasticity in the blood vessels. So, degeneration of the heart's electrical system will often lead to a heart condition that causes an irregular heartbeat in the elderly. It's important to ask if they have a cardiac history. This condition is known as atrial fibrillation. It's pretty common. Most of you have probably heard of it, but this can predispose the elderly to form blood clots in their heart, which can cause strokes and other undesirable issues to occur. All right, nervous system. You have decreased reaction times, difficulty with recent memory, psychomotor skills may start slowing down. Assess for sluggishness, confusion, or diminished altered mental status when you're assessing them. Depression is a very common condition found among elderly adults. Our musculoskeletal system, you're going to have changes in posture, range of motion, and balance. Some elderly people will lose up to 3 inches of height due to deterioration of discs between the vertebrae and osteoporosis. During the aging process, osteoporosis causes a reduction in the quality of the bone, making skeletal tissue more brittle and elastic. This is particularly true in females. All right, the skin. The skin is going to lose elasticity and thickness Dark areas of pigment on the skin, usually called age spots or liver spots. Dry or flaky due to decrease in production of natural oils. The ability to perspire tends to decrease, so they may be at higher risk of developing a heat injury. It's just something to keep in mind. They also don't regulate their body temperature in the cold as well. So also, as the skin becomes thinner with age, it's much more prone to tears, even when it's just minimal trauma. Just use extra care when you're handling these patients. You do not want to cause any further injury by the way you're handling the individual. Figure 25.5 is just common changes in the body systems of the elderly. It's something I'll give you about 10 seconds to look at, and you can look at it further in your book. All right, here's a scenario for you. You respond to the home of an elderly female. A neighbor greets you and tells you that she went to check on the patient. She found her on the floor. You see a significant skin tear to her left elbow and a bruised bump above her left eye. She is confused, which is a new finding, and she has osteoporosis. How do you proceed? All right, so you're at the home of an elderly female. Her neighbor just found her on the floor. You see a significant skin tear on her left elbow and a bruised bump above her left eye. She is confused, which is a new finding. How do you proceed? You want to assess this patient, complete your primary survey, and a rapid trauma assessment since she's confused. You want to treat this individual as she may have a head injury, and you just want to go from there. One thing to keep in mind, if you're going to put this individual on a long spine board, it may be very difficult. If she's got kyphosis, which is what would commonly be referred to as a humpback, you may not actually be able to put her on a long spine board, so you may have to just take some different precautions. All right, assessment of geriatric patients. All right, so of course, as always, you're going to perform a scene size up. You're going to look around the area. Do they have adequate food, shelter? Are they in a clean environment? Um, is their environment conditioned with air? Do they have a working heating or cooling system depending on the time of the year? Are there any potential fall hazards around? Look for any conditions that suggest abuse or neglect. All right, when you encounter evidence of trauma, consider the possibility of abuse until it's proven otherwise. Unfortunately, caring for an elderly person can be frustrating, and some people lose control, and this can lead to significant abuse of an elderly patient. It's just a terrible situation, but it's very common. During your primary assessment, you want to complete your primary assessment. Make note of position of the patient. Confirm the airway is clear and breathing is adequate with a good tidal volume. Confirm that the individual has adequate pulse. Confirm that no immediate threats to life before moving to secondary assessment. Why do you think it's important to first talk directly to the elderly patient rather than asking family members your assessment questions? You don't know what their cognitive ability is. They may be just as sharp as anybody else. And if you're referring to family members instead of talking to them directly, it may offend them. So always attempt to get information directly from the patient before you move on to family members. All right, obtaining a history. Gathering a medical history on an elderly person may take quite a bit of time. They may have several different medical conditions. They also might have quite a few medications that you're having to go through and determine what they're used for. Be aware of the patient's surroundings. Verify information with a reliable source such as a caregiver. That's not to say that you can't take what the elderly person is telling you for the truth or for fact, but you don't ever know. They may have some issue. They may have dementia or some other type of issue that prevents them from being able to remember things clearly or know their exact information. So just always confirm it with somebody else that if it's possible. All right, the physical exam for geriatric patients. Just make sure you handle them very gently. We discussed earlier they're very prone to skin tears and they have brittle bones a lot of the times. Histories and exams can easily tire out elderly patients, so just bear with them. You may not be able to move as quickly as you would with a younger individual. Always explain what you're going to do before you do it. Anticipate numerous layers of clothing. A lot of times they're very cold or they may be trying to save money by not running their heat. So they may have quite a few layers of clothing on that you may have to get to. Always respect their modesty and privacy. Just because they're older does not mean that they don't have any modesty. So just keep that in mind. All right, here's a scenario to think about. You respond to a single vehicle motor vehicle accident and find a 72-year-old female seated and restrained in the front passenger seat. Her son, who is the driver, is uninjured. Reports that his mother had a stroke 1 year ago and is unable to speak. How might you conduct a thorough assessment? So you can still talk to her. You can still tell her what's going on. She'll likely be able to understand what you're doing even though she can't speak. And as far as gathering history and information, her son will most likely be able to provide you with any information that you may need. All right, common medical problems of geriatric patients. Some common illnesses would be pneumonia, chronic obstructive pulmonary diseases or COPD, cancer, heart failure, aneurysm, high blood pressure, stroke, dementia, Parkinson's disease, diabetes, bleeding in the stomach, esophagus, or intestines, urinary tract infections, reactions to medications, Alzheimer's disease. All right, so how might a substance abuse or prescribed painkiller dependence impact the medical condition of a geriatric patient? This is something that can affect a geriatric patient just as it can any other individual. If they've got alcohol problem, they're going to present similar to a young person that has alcohol problem. If they have issues with painkiller dependence, they may present the same way as a younger person. It's a difficult situation no matter the age group.
Alzheimer's disease is a progressive degenerative disease of the brain, characterized by loss of memory and other cognitive functions. It is the most common cause of dementia among people aged 65 or older. The neurophysiology of this disorder consists of alterations in the cerebral cortex, senile plaques, neurofibrillary tangles, and atrophy of the cerebral cortex.
Yes, he has. I saw him last night.
Alzheimer's usually begins after age 60, and risk increases with age. At first, the only symptom may be mild forgetfulness. People may have trouble remembering recent events, activities, or the names of familiar people or things. People in the middle stages of Alzheimer's may forget how to do simple tasks, like brushing their teeth or combing their hair. They begin to have problems speaking, understanding, reading, or writing. Later on, people with this disease may become anxious or aggressive, incontinent, or wander away from home. Eventually, patients need total care. The cause of AD is not known, and there is no cure. Suspected risk factors include age, family history, diet, and environment. Viruses are being studied to learn what role they might play in the development of this disease. No treatment can stop Alzheimer's disease. But for some people in the early and middle stages of the disease, some drugs may help prevent some symptoms from becoming worse for a limited time. Developing new treatments for Alzheimer's is an active area of research. Scientists are testing a number of drugs to see if they can prevent, slow the disease, or help reduce symptoms.
All right, injuries. Trauma caused by falls is going to be the leading cause of injury and death among the elderly. Look for potential dangers such as unsecured rugs, loose handrails, unsafely stacked items. Make the caregiver or family member aware of these safety concerns while you're there. So, elder abuse and neglect. Unfortunately, this is way too common. Uh, it can be very overwhelming for somebody to take care of an elderly individual, and a lot of times this leads to neglect or abuse. So, abandonment or deprivation of basic needs to include food, water, housing, clothing, or medical care are very common. This can be because of economic issues, or this can be just because family members that aren't prepared to care for their loved one. Or self neglect. This is the inability or unwillingness to provide or care for oneself. They may just be tired. A lot of times, the elderly people you come in contact with are just tired of being sick, tired of getting old, and it can just lead to depression. They just choose to stop caring for themselves. Our elder abuse can be physical, sexual, emotional, or verbal, or also financial. Our indicators of abuse and neglect, you may see sores, bruises, and other wounds, a general unkempt appearance, poor hygiene, malnutrition, dehydration. One thing about the sores, bruises, and other wounds to look at is if you have bruises or other wounds in various stages of healing, this may point to a frequency of abuse or a frequency of injuries that could fall in line with abuse. So that's one thing you want to keep in mind. All right, always advocate for the elderly. As an emergency medical responder, you have a duty to serve as an advocate for your patients. So if you feel like somebody's in a situation where they're being abused, you need to say something to someone and try to get them out of that situation if possible. All right, common signs of suspected abuse are going to be unrealistic, vague explanations for injuries, an obvious delay in seeking care, unexplained injuries that could be from the past or from present, poor interaction between the patient and the caregiver that's on scene. All right, here's a scenario. You respond to the home of an elderly couple for an unknown complaint. You find an 80-year-old female with a history of Alzheimer's disease in her bedroom. She has a red area under her eye that is rapidly swelling. When asked what happened, she states, "He hit me. How do you proceed?" First of all, just because she has Alzheimer's does not mean that she can't have a recollection of what just occurred. He very well could have struck her in the face. At the same time, she could have fallen and injured herself. You've got to take her allegations seriously, though, and in that situation, you need to involve proper authorities. I would get law enforcement involved and proceed to care for the patient just as you normally would. All right, summary. Assessment and emergency care of geriatric patients can sometimes be challenging due to normal age-related changes in the human body. Geriatric patients have multiple illnesses. They can be taking numerous prescription and over-the-counter prescription and medications. They can have problems with mobility, have issues with incontinence. All right, respiratory system. They have a reduction in strength and endurance of the muscles that assist in breathing, loss of lung elasticity, collapsing of smaller airway structures. Circulatory system is affected by thickening walls of the heart, reduction in effectiveness of the heart's conduction system, loss of elasticity of blood vessels, reduced cardiac output, dysrhythmias, aneurysms that may burst. The nervous system, slowing of psychomotor functioning, decreased reaction times, forgetfulness, falls due to the loss of sensation and coordination. Osteoporosis and degeneration of musculoskeletal system can cause bone weakness and general instability. This makes immobilization and airway maintenance a challenge. We talked about it earlier. You've got a condition known as kyphosis. You see it a lot in the elderly where they just look hunchback in appearance. This makes immobilizing somebody on a spine board nearly impossible. Right, the skin becomes thinner and weaker. They're more susceptible to tears or injuries. It's also slow to heal due to sluggish cellular regeneration. All right, always look for indications in the patient's environment. You're looking for unsafe conditions, non-working heating and cooling systems, signs of abuse or neglect. Ensure modesty and privacy when physically examining a geriatric patient. Elder abuse can be physical, emotional, sexual, or financial. By financial, an example of that would be say that you've got a elderly individual living in a home and they deprive them of their money and they just do not allow them to use their own money for anything. They may just be completely unable to have any type of items because their loved ones are taking their money. All right, so as an EMR, you have a legal duty to report suspected cases of abuse and neglect to the appropriate authorities. All right, this is the end of chapter 25. It's fairly brief. There's a lot of good information in here. Make sure you spend some time reading it in your book as well.